The whistle blew, but work has just started. Welcome to the Injury Time podcast. I've got Kiran and Hazwan here. For the first time, we're in the same room together. And today is a bit special. We're going to talk about concussion. So, Kiran, why are we talking about concussion?
Why are we talking about? Because I think relevancy right now, we're just going to start the Super School Rugby and Piala Agong coming up. So I think, and what's happened recently in football, I think it's a good time to talk about it. Concussion. Yeah.
But people will be asking, why didn't we put this up as the first topic? If it's so relevant and it's something at the forefront, I think for us in sports medicine.
No, I mean, I think it's because of recency, right? Like what happened and what's going to, like, I think you're covering Super School or who's covering?
Well, it is a sanctioned tournament under Malaysia Rugby and with Piala Agong coming up. And I think why we decided for this topic was way before what happened in the ACLE last Friday. But then because World Rugby has always been on the forefront in terms of concussion awareness, concussion education. So I think with what's coming up in Malaysian Rugby, it's a good time to just revisit the topic and remind everyone what is concussion all about.
Yeah, so we have been talking about it like nearly all the time, every single week or every 2 weeks when we do our courses and all. And yeah, so let me start it off lah. What is concussion, Hazwan?
So concussion, in layman terms, to make it easy, it is a traumatic brain injury. So no such thing as saying it's just like otak bergegar or just a shake of the head, just a knock to the head. No, it is in simplest term, and to make it easy, it is a brain injury. Is it mild? Is it severe? No, it is a brain injury. No such thing as that. So if you were to give a textbook term, it is basically a brain injury, which is more functional rather than structural and cannot be assessed from normal radio imaging such as CT scan and MRIs.
I agree. So it's structural, but tiny structure. Actually, is on the cellular level.
Yeah.
So normal, like Dr. Hazwan said, normal MRI and CT scan, you won't able to see it. But when you do all these high-tech things in the universities, like, what do you call that, MRI with flow, something, high-tech stuff, then you may be able to see lah. Okay? So Kiran, how does someone with concussion present? Do they have to be knocked out?
No, I think, but they don't have to be knocked out. But I think that's the common misconception. Like everyone thinks concussion, you must have fainted or loss of consciousness. But it's definitely not. The other thing that people get confused is they think concussion, it must be a direct blow to the head.
All right. So two things Kiran point out. He said one thing about what you can see, and also what's the mechanism.
Yeah.
So we talk about direct is pretty straightforward lah. Like what happened in the ACL, straight to the face, right? What about another mechanism? How does an indirect injury looks like?
Indirect, basically, there's no direct hit to the head, but then the motion of your head goes from a flexion to an extension movement. So that's where like what Hazwan said, the gegaran otak happens, and then you get the cellular injury.
Yeah.
And then
so pertaining that, if you can imagine you're in a car collision, your head doesn't go through the window or something like that, commonly, but that can happen. But it's because the transmission of force actually going all the way up to your neck and your head.
Yeah.
So that's what happens. And in sports, I guess, when you rugby, you kena tackle. Bukan tackle kat kepala lah, tu lain lah, tu high tackle lah, boleh jadi juga. Tackle kat badan, and then your head move forward and all. But recently what I saw is not the counter coup mechanism only, where you go front and back and get knocked, but also the twisting motion, the rotation.
Yeah, that can
So we can talk like in medical terms, is more like a diffuse axonal injury kind of thing. Yeah.
That's more of radiological term lah. So when it's a bit hard to see if for everyone that wants to know what is a DAI, diffuse axonal injury. So if you look at a CT scan, so basically what you see is maybe changes in the grey and white matter, but there's not much differentiation there and clinical findings. And so usually that's when we would term as DAI. Sorry to my radiologist friend, is my explanation is not that exact or precise. But to make it easy, like how Azlan said, actually our brain is floating inside our skull. It's bathed in the our cerebrospinal fluid. So any rotational, any movement, so it's just like what you say, it's the inertia that what causes the injury. So it's interesting because in rugby at the elite level, we have what we call they use a special mouth guard.
Yeah, instrumental mouth guard.
Instrumental mouth guard. One of the things that they measure is actually the amount of force that's created either from an indirect or direct force. So it's just getting tackled around the abdomen. If the force that's detected by the mouth guard is above a certain level, it will flash up and then you have to go for a further assessment. Another one, it's people have been talking about force, but part of that mouth guard is actually the oscillation. So basically the rotation.
Yes.
Part.
The gyroscope part.
So that's where they detect also. So if it goes past a certain degrees per second, it will also be lighted up and we are being made aware. And for elite rugby, that's when you get called out for HIE, even though you might not even have demonstrated any sign and symptoms of concussion.
Yeah. It's like increases the pickup rate lah. In that kind of sense, right? Detection rate lah, screening lah.
Yep.
Okay, let's go back. So we talk about the mechanism. What about the signs and symptoms? Selain benda tu, when you get hit, it's quite obvious if someone is passed out on the field.
Yeah.
What about other things? Like what other symptoms that we can see when after trying to get up, they can be a bit slow. They could fall back down. They could look like someone who's drunk with unstable gait.
They could complain of dizziness.
Great, dizziness, yeah.
They could complain the world is spinning around them, or they blurring vision, they vomiting. That's always not a good sign.
So I like one thing that macam during the courses Hazwan would always try to explain lah. You always say what concussion is like?
Concussion is just someone with hunger. When you're hungry, so you'll get then it's easy for you to remember lah. So when you're hungry, number one, you'll get emotional, hangry.
Okay.
So there's emotional lability. So you're more labile. Either you get angry or sad. So you tend to see this in players sometimes. Okay, when they come, why is he a bit more emotional and all? Okay, maybe you lost a game and all. That's perfectly normal. But then for us doctors, sometimes we tend to miss that. Basically he is out of character, and you see plenty of our friends when they're hungry, they're totally out of character lah.
Yeah, I've seen the prop after getting tackled started crying, like macam baru break up. I've seen that also. Alright, that's not normal lah. Okay, and other things apa lagi?
That's why you cannot focus, lack of focus, difficulty to concentrate. And then you feel drowsy, you feel lethargic, you feel tired. And some people, this is another one more commonly missed. It's because you have difficulty sleeping. So sleep disturbances. So like someone yang, if I'm hungry, I have difficulty. I just have to go and get something. So
yeah, makes sense.
And what else?
It ties up to what happens in concussion lah. You actually have a NG crisis in your brain, and also at a cellular level, where your brain needs like a baseline to work, but then because of all the things that's happening, there's mismatch in energy available and needed.
Energy consumption,
yeah. So that's what can happen. What about another thing I want to point out? Not every single hit and every single person who pass out or get the symptoms is not always concussion.
Yeah.
It could be a spectrum of things. It can also be a traumatic bleed. Darah dalam otak boleh juga. So those people, we would be able to see if they can see some red flags. So just like at the beach, if there's a red flag up, you cannot swim lah unless you're looking for trouble. But
Yeah.
anyways, so what are the red
But
flags?
what if you've paid for that trip? Beach rating and the red flag is up. It's like, I already paid like expensive.
Makes sense because like that's what the players are gonna say. I came all the way here, traveling team on a tour, and I paid for this first game. Pop kena.
Yeah.
Right?
Come first game, first minute, first tackle.
First minute, first play maybe, and that can happen lah. All right. So we have a few red flags. So loss of consciousness, pengsan is satu. Sawan, having seizures.
Yep.
Okay. Kiran, can you show how?
I think Hazwan is good at that. Right? Acting. Yeah. That's Hazwan. So,
Seizure lah.
That's one of the seizures. But I think the most popular one that we've seen, you guys can see on the highlights on the ACLE last Friday what happened.
Yeah.
So might subtle. So those who are aware of it can see what we call tonic posturing or decorticate position. So that's where you can see like as if someone's pointing to the sky or pointing up to something. So it's not, it's like they're calling for help or something.
Yeah.
No, it's because your loss of
Because, like,
consciousness,
like that.
localized focal seizure.
Yeah.
So those are one of the things that.
That one's a good example actually.
Yeah.
The ACLE thing.
What are the red flags are there? I think multiple
neck
vomiting.
pain.
Is
Yeah.
there? Neck pain.
Neck pain, that's also. So with any head injury, you cannot rule out any cervical neck injuries. Numbness. Some people just complain of dizziness and all. They can talk to you well, but then they complain of numbness or tingling sensations, weakness. So not just that. And then I think what you say, vomiting. I think vomiting once or twice is okay. But then if it's continuous or just worsening from just feeling nauseated and then it's like, then that's something that you have to be aware of.
Or worsening headache.
Yeah.
Yep.
Worsening
Sakit sikit, makin teruk. That's another thing lah.
Worsening.
I've seen that before.
Worsening consciousness level. So basically, he might be drowsy, but then now he just wants to sleep and all.
Yep.
Yeah. It's a spectrum.
It's a
From what you
spectrum.
said.
And just to point out, it's not just during the initial 10 minutes, 30 minutes. The symptoms can be evolving up to, if I'm not wrong, 72 hours, right?
Yeah.
Up
That's
to
the critical part.
Okay,
Yeah.
let's just use as what is practiced in rugby, world rugby at the elite level.
Okay.
So we apply what is called a head injury assessment, HIA. So if there's a suspicion of concussion, then you want to rule that out. But this is at an elite level. So kalau kita cakap at community level, it's not part of the topic lah. But it shows the evolution on how fast, how soon you can recover from concussion, or how delayed it can be. So you have you can get taken out. So immediately during the game.
Correct.
And then you have to do another assessment within 2 hours after the
game ends.
after the game.
Yep.
And then you will be doing another one the following day.
Yep. Following day.
That is for sevens.
Yep. For sevens.
So and then another assessment. So that's why we can have early symptoms, delayed symptoms. Okay, so that's when we know. Sometimes it's not immediate, but sometimes you can have like 12 hours later for 24 hours and up to 72 lah.
Yep. But do we practice that in Malaysia?
Unless
so far that we've been in rugby scene for like what, 10, 15 years?
Unless you can give me like 8 camera views and you can give me a very nice studio like where we are now.
To
And then
review
for
it?
me to review with all the camera screens where I can roll back in real time, and then a good communication with people pitch side. So I've experienced it before during the World Series in Singapore last year. And I have to say that inside the control room, there was 3 of us, plus the technicians and all that's going to do the playback. And then you have another 4 or 5 on pitch side, doctors trying to localize, trying to visualize, and some are looking at the data from the mouth guards and all to see for the knocks. So in terms of an economic sense, not really viable to be done in Malaysia.
Yeah. I remember you telling me like there's like it might cost up to how much? To set it up in Malaysia?
I think that's where we have to ask our friend lah, Afiq Go is involved in broadcasting and all, how
Okay.
much at each camera and where can zoom in, zoom out and all, and look at individual players and all, how much it costs. So I think just for a normal one day shoot pun dah cost you about at least 2,000, and that's for one
Okay.
camera.
Okay.
And then you're
So
talking about
you have to scale that up lah.
yeah.
So there's a lot of money involved. So you need all those things lah, and also a dedicated team.
Yeah.
Right. So in Malaysia, actually, we practice for rugby lah. We practice recognize and remove. Even at Asia rugby level, when the tournaments are held here, we're still doing recognize and remove.
Yeah.
So it's in the name. You recognize the signs and symptoms, and you remove.
Yeah.
Yeah.
Similarly, actually, I think Kiran encountered this also in football. I think you've seen even at the ACL women's level.
Yeah.
So I think you've experienced that as well. I think during the briefings, still recognize and remove, right?
It's all recognize and remove. I don't think at our level we have, like what Hazwan said, that kind of environment to capture it more precisely. So I think the safest thing is to recognize and remove. Even in women's football, last year we had a case where we had a direct knock. Patient was clearly concussed, and to make things worse, she fractured her nose, and that makes it more complicating lah. But ultimately,
Good. So you say not good that she got it, but the fractured nose.
Yeah.
That's another thing that I want to point out. It's something that can be very distracting.
Yeah. So
Right.
So if everyone focuses on the most obvious thing, it's pretty easy to miss the what's more internally lah.
Yeah. But
So
just imagine lah, that much force can break your face. Confirm lah, it will transmit to your brain kan.
yeah.
That can happen lah. That's what you need to think about lah. Okay.
But I think coming back to the recognize and remove thing,
okay.
The other thing is about education, right? So if you're just going to rely on the doctors to recognize and remove, fine, that's their job. But I think even the coaches and all need to be aware of this, because in a high-stake game, and if it happens to one of your key players and things like that, it can easily become a problem if the coach views it as I want to win the game, or the player views it as I want to win the game, and then the question of safety becomes or gets thrown out the window, and the doctor is the one that has to, I wouldn't say shoulder the blame, but has to make the main decision there to take out the player, regardless of the situation that's unfolding.
Interesting. Kiran said that because we are talking about if you're a team physician, of course your priority is towards
Safety.
but for the benefit of the club. So of course you'll put the aspiration of the organization first and all.
Yeah.
So sometimes that's when you say, the player says it's okay. So it might just cue the coaches say, it's okay, and the player is adamant saying that it's okay.
Yeah.
So when it comes to that, it might just cue your judgment a little bit. So that's a challenge for us doctors. So we might follow that, but then we are not sure somewhere along the line. So if I'm not mistaken, we have one of an ex-Premier League player, EPL. Okay lah, Man U, as Man U fans, we follow this. One of the ex-players is actually suing the club for medical negligence.
Yeah.
Yeah.
And this is a bit off topic. It's not about concussion, but then it's just about a hip injury.
Yeah.
So, but then because it's persisting, and he was saying that he wasn't given proper advice and all. I'm not saying there's anything wrong with that player, but we don't know what happened there and then. But then this could happen for us as maybe those who are involved as a team physician.
Yeah.
And then agreement, the player understood the risk, the coaches understood the risk, but when you go forward down the line, the sequelae and persistent headaches and all, memory changes, and suddenly the doctor masa tu bagi je main, you agree? Yeah, I know, I agree, but he didn't even explain to me properly this what could happen in the future. So that's the risk that sports medicine physician who wants to be involved in high performance sports putting, I don't know, I'm not saying professionalism down the line, but more of career sometimes down the line.
Yeah, but I don't know. I think if you I mean, we have to educate, right? That's
Yeah.
the first thing.
Mm.
So if everyone is educated that, okay, this can possibly happen, and you have to build that trust lah with the coach, with the players, right? If you're the team physician,
Yep.
if you're the team physician, even from the start of the season, you should have like baseline neurological exams and things like that, and you educate them and say that, okay, guys, this can possibly happen. If this happens, and if I make a decision to take the player out, please understand that I'm doing this for your own safety, regardless of the circumstances, regardless of are we in the final and it's the last minute and things like that lah. So
That's a
The
challenge.
interesting
it's a
part is
challenge.
that-
It's a challenge,
Yeah.
but it needs to be done. But
Correct.
how many professional teams do that? And how
Yeah.
many rugby? I mean, rugby, yeah, fine. Football or any contact sport for that
Yep.
matter, which have a team doctor or team physician. How many people actually practice that?
Yep.
And how much of the coaches and players buy into it? That's the other thing.
I think the awareness
Yeah.
is somewhat getting better,
Better, yeah.
but also, yeah, I think Hazwan got something to say about this lah.
It's a double-edged sword. Okay, it's a double-edged sword
Yes.
because the more you know about it, the more some people know how to circumvent the issue. So, good example. I got a tournament organizer, quite a big one. I'm not gonna mention who, which, and involving who.
Mm.
But they've been doing it for quite some while, and they say, oh, we've got the injury data and all. And we're happy to say that actually the concussion rates are going down and last year's was the lowest. Of course, if you were to look at it, oh, okay, everything is looking good. The concussion rates are going down and all. But it does not tally if you look in context of world data.
Okay.
Okay, because concussion rates worldwide is going up.
Yeah.
But why your tournament being held for the past few years, the rate is going down.
That's a
So it does not. If you were to look at that data in isolation, very good, you've done something. Or now those that's involved for the past few years, no, we should not report it.
yeah. So it's
We
underreported.
should hide it. We'll just
Okay.
manage it, and so to benefit
Right.
our team rather than going through the whole process of
Okay.
resting and all. So it's a double-edged sword. So that's the danger of it.
Or it also can be maybe the people taking care of the tournament, let's say doctors or physios or paramedics or first aiders, they're not trained in this. Also possible.
So
There
they
could
can't,
be so many layers to it, right?
meaning
But
what
if
they
I'm-
didn't recognize.
Didn't
They can't
recognize and didn't remove lah.
Yeah.
Or
Ah.
because in this current situation, I have to say it's a rugby tournament and it was sanctioned.
Oh, it was sanctioned. Okay,
So
interesting. When
so-
sanctioned, it means that the application will either go to Hazwan or me. We will need to see whether the doctors working there as a match day doctor is one has some rugby experience, which is either level 1 first aid in rugby or level 2 immediate care rugby, and how long was the cert ago, and also has that person has been on the field or not. You will try to look into that deep lah. Okay.
Meaning what? That means has he practiced?
Has he practiced?
yeah,
Has he
so
practiced yet?
it's not just theoretical.
Yeah.
You know how some courses, pitch side courses,
Yeah.
and
Just
when we
to
look at those delivering those courses, it's a bit interesting to see. I've never seen this person manage concussion before, but giving talks about concussion, and then also not even those involving pitch side lah.
Yeah.
Okay. All right. So that's
So my
the
rebuttal to that would be it could go both ways. Sometimes maybe it's access to covering tournaments and being involved in sports. They want to do it, maybe, I'm saying. I don't know for sure, but they never had the chance.
Yeah.
Also, why are we not doing it lah? As
That's
simple
true.
as that lah.
That's
Right.
true.
We're going through the rugby side, but
Yeah.
of course there's other side that we can explore also lah. Of course, maybe we also need to do more lah. Just to be honest lah.
What do you mean by doing more? My thesis was on concussion awareness.
So, what do we need to
our
do?
knowledge and awareness.
Okay.
When I first presented that topic, eyebrows were raised like, is it really relevant in our local setting? So of course we have no baseline knowledge and awareness, and just trying to gauge that. But then it was quite interesting to get that feedback. Do we really have that many cases of concussion that we want to check in terms of knowledge and practice?
Actually, your answer is right there lah.
Yeah.
The people counter checking it also is not so sure because maybe we don't have the data.
So comparing it with international data of the same survey, we were the lowest.
Do we have concussion data in rugby, Malaysia?
Yes,
We do?
we do.
For how many years?
Yes, we do. So for all sanctioned tournament, we have all the injury reporting since 2019
2019.
for Piala Agong, for National Sevens, and some of the sanctioned tournament, especially involving Selangor Rugby. Yeah. So Nick Haziman has been keeping. So we do keep our injury registry and all, and so. Actually, what we have is that anyone that's diagnosed with concussion, we have a form. I think we can put that up. This is an example of two.
Yeah.
So in order for them to return, they have to return back the form with the signature of the doctors that assessed and cleared them. So that's the level that we go through.
So this registry has been 2019, is it?
Yeah, we
But
have it there.
but it's only Agong Cup and National Sevens.
Yeah, it's
hosted
definitely not
by
the
Malaysia
whole of
Rugby,
sports.
so
it's not a-
rugby,
yeah.
a small subset of.
So
rugby.
that's one limitation right there, right?
Correct.
So
We don't have a national database where we get everything.
I would say because it's Malaysia Rugby organised tournament. It's not a Malaysia Rugby sanctioned tournament. So even for Malaysia Rugby,
Okay, yeah, fair.
Malaysia Rugby under 18s, we do have the data.
Yes, we do.
Yeah. So I cannot comment for any other sports if they do have it, but to see on how many knee injuries or in terms of regions, we do
But
have that.
if you guys have that information, please share it with us so that we can, share that dissemination of
We would be
information.
more than
That'd be
happy.
great. That'd be great. So talking about that, right? If let's say, Kiran, you get hit today and tomorrow you're okay, can you play the next day?
you would think so, yes? You would think so.
You would think so, yes. Okay.
Yeah, but
He would lah.
I wouldn't. I
If
wouldn't. I sayang my brain, bro. I wouldn't. But
if
so I think to answer your question, I think people need to be aware of this GRTP or graduated return to play protocol that we have.
So no, it depends on which sports you're
Which
talking
sports,
about.
yeah.
So we have stages,
Yeah.
and then at least 48 hours on each stage.
Yeah. So minimum is
12
if you
days.
go 12 days.
12 days, yeah.
Yeah, but that's so where I find, like in my clinics and all, when we try to do the GRTP, especially for professional players and stuff, it's like it's very hard for them to follow the protocol. And coming back to your question, they think once I'm symptom free, that means I'm good to go. But that's where we need to tell them about the whole protocol and how can we make them understand why you have to go through the minimum 12 days.
Yeah.
And why if you go back earlier, what you could possibly face if something happens again.
Can you just mention that the possibility of death is there with a second impact syndrome?
I always say that.
Yeah.
I always tell my patients that you could die. Because I think they need to know that.
Yeah.
That you can get the second time it happens within that short space of time, the second one will be much more severe than whatever you get the first one. And not just that, I mean, that is the more ganas part, but there's so many other things in between that could happen, early onset dementia and things like that.
I would take an early death better than
You
than
think
suffer going through like you're saying.
It's terrible.
Yeah,
You
because
hear
it's
so many
terrible. Sorry,
stories, especially like from ex-NFL players and all.
what's that movie?
Concussion.
Will Smith, right?
Will Smith.
yeah.
That's a good movie.
Yeah, I think that's a good movie for
CTE.
people to understand. CTE, yeah.
Chronic traumatic
Encephalopathy.
Yeah.
So but
chronic,
this is
macam something lama.
Yep.
Okay, traumatic, trauma lah. That's injury. Encephalopathy,
brain changes.
brain changes.
Yeah.
That's what you can see. So to argue, maybe Muhammad Ali,
Yeah.
he was not actually Parkinson, but secondary
Maybe.
Parkinson.
Yeah, maybe.
Maybe due to CTE. It could be.
that's the thing when it comes to sports. Sometimes if you were to label something like that, concussion will lead to this. I'm not saying that to demean any sports or anything, because of course it's about marketability and all.
Betul, I agree.
But the aim of boxing, the aim of martial arts is actually to create a concussion.
Correct.
That is the sole aim, trying to get that knockout.
Yeah.
So if you have repeatedly, so maybe in some terms you will see, this is a punch drunk syndrome.
Yeah.
So, or I don't know, any more fancy terms, or Parkinsonism.
Parkinsonism.
Yeah, so it's just that you cannot do a live biopsy on someone who's alive. We only have one brain. So we just have to remember that, you can even transplant your heart nowadays. But if we have technology to transplant the brain, by all means lah. Then we might give some discount when it comes to brain injury, where some people say as trivial as concussion.
That's true. And I've been seeing this working group. I forgot where is it from. I think either
CICG.
South Africa or
CICG.
CICG, is it?
Concussion in sports group.
CISG.
There's some correlation that they're seeing. People who have had multiple concussions, apparently they're saying they have more likely to get ALS, your Lou Gehrig syndrome.
MND lah, motor neuron disease.
Motor neuron disease. Okay, so they have widespread pain. They can't really do much. Oops, sorry. Something like that lah.
but
How many times you knock your head?
Yeah.
Oh, honestly,
You fell as a child.
I fell as a child. Yeah. I think basketball once. Took an elbow. Yeah. Another one.
I remember getting smacked by you the other day.
That one
Don't
was
not
not
tell these kind of
concussed.
things. Ay.
That was
You're
concussed.
imagining things lah. I think you have problem, bro.
I
That is
have to
everything.
admit, I remember I can recollect a few concussions in my school
That's
days.
what you can remember. What about the ones that you cannot remember? Okay, go on.
Good one. Never thought of that lah. Maybe that affects some of my thought processes sometimes. Okay. But I'm where I am right now, so doing not too bad. Might be somewhere else if I had less concussion. I don't know.
Kiran, is he blaming head
I
injury to
think- I
his
think
own
he's-
condition?
Yeah.
Is
I think
he
he's just-
externalizing it?
Well, I have to
Boleh lah,
blame
boleh lah.
someone. I have to blame someone or something. So
Aduh. Okay. I think we went on quite a lot pasal concussion, what we do in the long run and everything kan. What about on the field? How do we approach if, let's say, you see, football, someone go in for a header, there's a head knock with the goalkeeper ke?
let's just
And
say
it's a line down.
got overhead kick, just whack someone in the head. lah.
Overhead kick.
So
Yeah,
everyone
like
can
that.
replay what
Yes.
happened last Friday to over and over again and see.
Yeah.
So
And
how would you approach, Hazwan?
Okay, so actually the principle of speech side care, sports medicine is always the same. This is considered a medical emergency and it overrides game authority.
Yeah.
So the medics have to be aware on what's happening. You have to understand the sports. You have to understand the mechanics of it. Or if there's a head knock and then you see someone just fall like kena lipat just like that. Terlipat badan dia and all, and then having that tonic posturing and all. Then you have to enter the field of play. So make sure it's a safe approach. You're safe and all. Make sure the environment is safe and all. And the mainstay is actually to protect the neck. So that's why you have to apply manual inline stabilization, and as soon as possible do your initial assessment, your airway, breathing and circulation. And most of the time someone knocked out, you are worried about the airway lah.
Yep.
Yeah, so that's where you do your jaw thrust and applying
Your first aid skills that you do.
skills. Yep.
Because someone who's unconscious might not be able to maintain their
Airway.
airway.
Yeah.
So if there's no airway, your saluran penafas is not there,
No
breathing
breathing.
cannot happen lah.
Yeah.
If not breathing is happening,
No
your
circulation.
blood circulation also is leading nowhere. Eventually that condition can lead to death.
Cardiac
technically,
Technically.
if you don't have A, B, C, you're dead.
No. So it could be that also.
Yeah.
You are busy protecting the neck and
Yeah.
all,
Yeah.
but the person could be not alive also at that point of time.
Yeah.
Okay, so many things can go wrong. So you need to follow that algorithm lah, S A B C D E. Definitely we can teach you guys or facilitate you guys through that. True.
Can contact Azlan or me.
This is an advertisement now.
Yeah,
No.
it's a-
This is about education,
Education.
Okay.
awareness.
Yeah, first aid rugby or level 2 immediate care rugby for the healthcare
we're not
workers.
supposed to mention any courses here.
Oh yeah.
Yeah.
Why?
It says no advertisement.
Ayo.
It's up to you guys, man.
So yeah, like you can get in touch for training education and all. Find out materials. You can find, a lot of materials
Internationally
online, so,
accredited syllabus.
Syllabus, yeah.
You gonna put the number down there? or-
Number,
We'll put our email down there.
Okay.
yeah. Oh, you can DM us. You can contact us. It's fine. Like if you guys want us to help problem solve something when it comes to sports medicine, it might not be just about concussion. We can definitely help. Okay.
But you just talked about just now immediate care. Of what happens after that, Kiran? You said you've managed a few in your clinic.
You mean after that?
Yeah.
After the game?
After the game and the few days and eventually to return to play. Do you use any kind of tool part of your assessment?
Yeah, I mean the most famous one is the SCOT or the office tool, right? Now we're the sixth edition now.
Mm.
So, but personally, to be honest with you, that's a very good battery of tests, which includes memory and gait and things like that. But where I feel it's just to guide us lah, right? Ultimately, is you have to have you have to make a clinical decision on how your patient is going and when you think they are ready to return to play. The guidelines are there and everything, but where I want to bring this up is that baseline thing lah, that I was saying. That
Correct. I agree.
if you have a baseline, then you can always compare to. I had just about a month ago, one of our football players, he knocked his head into a cement railing at the side. I think you all know who it is lah, but he was concussed. And when he came to my clinic, like I could assess him and things like that, but we didn't have a baseline. So I have to explain to him also lah that we don't know what his baseline is. You see? Because some of the tests, if you go through that scope, it's not that easy anyway. Even if you're not concussed, so it's
the
some of the memory
part.
part. Yeah, it's not that easy. And what I feel is that sometimes when the player does it, see, the player comes to you, he's scared also, right? Sometimes they're worried, like, what's this going to translate? They're not educated that this could lead to this or this could lead to that.
Yeah.
And then someday when you do a test like that, and let's say I give you 10 words and you only can name me 5, how would you feel? Like, is this, am I concussed? Am I getting better? Am I getting worse? So why I'm saying this is because if you do it before the thing, so you can compare. Maybe the first time also he cannot name 5, right? And that's normal. It's nothing wrong. It's just can compare. So
In the ideal situation lah.
Yeah, in ideal situation,
you can compare with
correct.
it. Yeah,
So-
great. That's a great thing. That's something that the people who involved with teams you can do.
Well, there's a limitation because I had to apply HIA when I was with the UAE Indonesian team last year during the Asian series. So we use HIA. So we have our app and all. There was a few limitations. The biggest limitation is in terms of language. The form is in English. So if you're not familiar with English or you memang tak fasih in English. So we had our Indonesian players. Of course, they have difficulty memorizing this.
okay.
So
Do
I
you
think
feel
that's one
like
of the
you
things.
are in the fog?
No, I would be
I
like
would be like,
that.
huh? What?
So that's a limitation. So you have all these forms. We
Yeah,
don't
but-
have one in. That's why I think.
Yeah,
our
but we don't
sports-
have to follow, kan? I mean, you don't have to follow to the T. It's about the concept.
Yeah,
Meaning-
but that's the problem. When you go to a tournament that uses such a thing, then you have to follow suit with what's available. So you have the form in English, Spanish, Italian, French, Japanese. So I think sports medicine trainee, please do a translation lah as part of your
Malay.
part of your postgraduate punya
Yeah,
thesis.
it was
Please
really
do and
useful,
validate,
really
and
useful.
it helps for in the local setting lah. So create a translated maybe in bahasa Melayu and bahasa Indonesia.
Yeah.
Then you can use for nearly 100 million people already.
Yeah.
Which is gonna be, if it's validated, so then there we can apply to our international organizations, which make it easier.
Yep.
Yeah. The other thing to come back to that question is that when you manage these players, then or these athletes or whoever lah, right? The other thing is the coach should be there lah, or the physio should be there. Someone who's going to be with the player should be there, because part of the treatment is, because the problem with concussion is there's no drug or there's no injection or anything like that. The treatment is rest, right?
Yep.
Rest and then monitor
Relative rest.
rest, right? So if you don't have all parties involved, it's going to be difficult, especially in high stakes things lah, like player needs to be ready for next game, or there's a tournament coming up, or things like that, and then the player itself wants to play, but then the coach also is enabling the player, like, hey, I need you to play, right? But you're the only one who said that,
Sometimes
hey,
the
you
coach is
don't.
supportive, but the management,
Correct.
Yeah,
So
you're also right. There's
yeah
many
lah.
layers to it lah.
I pay
No,
your wages.
there's so many layers to this, right?
Yeah.
And the reality is that we haven't put ourselves in a right position where we can manage this better. And concussion is one of the things that we should take it more seriously. The problem is no one can see it on like Hazwan said, no one can see it on the CT scan or MRI, right?
Yeah.
So they cannot visualize it.
Yeah.
Fracture senang lah, right? See X-ray patah. Coach
Yeah.
also won't say anything, right?
Yeah.
He can see it, he can visualize it, right?
Correct.
This one I'm showing, MRI is clear. CT scan is clear. Then why you cannot play? Right? They might not accept that lah. And then the player also, hey, I'm okay. What?
Yeah.
Clear, everything is clear.
Yeah.
Why cannot play?
Yeah.
And you're the only one who's saying,
Mm.
you shouldn't play.
So next season
Yeah.
tak renew contract
No, hey,
so those are the things that
those are the things,
that can
Yeah.
happen as well.
But
you know?
but I'm not just saying that. So just adding on to that. Yeah, you might have team managements and all. I understand, because they are the one investing in it.
Yeah. Yep.
Okay. But
Fair also.
I've encountered before. This is at a school level tournament. Went out on a spinal board and all. The next day felt better. The teacher said he can play. I don't have enough players. I need him to play. I even bought my own doctor
And he
from
said,
I don't know where from. He's like, oh, it's not concussion. It's just like it was more of neck pain. Yesterday he was feeling a bit agitated, worried. So that's why he wasn't answering your question. So don't be surprised. I feel it's easier to handle at a professional level, Liga Super and even international tournaments. But school levels, that's a different beast.
Yep.
fair.
Parents coming in, this is not concussion lah. Biasalah main rugby lah. Biasalah kena knock macam ni.
Yeah.
Betul.
Habis tu tak boleh lah main rugby kalau macam ni.
Yeah, they don't start. They don't see it lah.
And
Yeah,
then
it's
you
like-
have,
During my time pernah kena ni,
Ah.
tak apa, I just walk it off.
Yeah.
You know.
it's like how I met your mother lah. This how I met her, kata, whatever it is. But then what irks me most is to bring in a third party doctor from I don't know where. Or they bring to a hospital, doctor kat emergency ke boleh kata, ni bukan concussion.
Yeah.
So that puts you in a bind. You saw him, you were the first to assess him,
Yeah.
sign and symptom of concussion. You know it is transient,
Yeah.
Yep.
can go off within 30 seconds.
I think that's a keyword though, transient.
Transient.
Yeah, that's
So-
the other problem.
Talking about the energy crisis, which I think some people don't understand, it drops.
Yeah.
Yep.
But for it to return back to normal takes 14 to 21 days.
Yeah.
So second impact, it can just drop below the minimum level that's required for your brain. So that's it lah. Your brain shuts down and innalillah. Okay? So that's what people don't understand.
Okay. Let me share like another case. This was a tournament. I think it was like 3 years back. I was still in University Malaya. I was taking care of the tournament, but I got referred this case. Hey, Lan, I need you to help check up on this player, because after a head knock, I think it was a 14-year-old boy. He had loss of consciousness, but regained consciousness when reached the emergency department at the hospital.
This is rugby or what?
Rugby.
Okay.
Sorry, wasn't clear about that. And when he woke up, he was still confused. He was not orientated to time.
He know himself.
He knows himself, but he thought he was still in primary school.
Oh.
Yeah, so that was scary. I got goosebumps. I've never seen something like that. I've only heard like movies and all, but it happened in real life. But it took him a while. I think about 2-3 days. Then slowly the memory got better and better and recovered. But kept him on a regular follow-up for quite a long time.
Yep.
How the
Serial
parents
follow-up.
that time? The parents were with him? Or
The parents were with him.
how did they take it? Like, how do you explain to the parents? And
Yeah. Of course, in that case, we had to do imaging because we're worried about other things. Is it a bleed inside? Is there something else happening that we're not seeing to make sure? Right? So that was it lah. Serially, we had to see. Any other cases that are interesting that you guys want to share?
Oh, I had one very interesting. Iskandar Putri Sevens. So we were packing up after the end of the tournament, after the prize giving ceremony. One of the players came up to me, Dok, nak tanya lah, saya okay ke tak? Sebab I don't have a headache, I don't feel imbalanced, but I swear to God, I don't remember how I came here.
wow.
Where did I stay and who I came with. My friend said that I came with them, but I cannot recall anything.
That's clear.
Wow,
So that was the only thing. No headache, no, he was balanced, he was fine, and then but he says he cannot remember how he came.
He had some awareness to check. Kalau tak, macam
Because of course you'll find it weird. It's like, actually aku datang dengan siapa tadi lah?
That's
Aku
interesting.
datang dengan siapa? Betul ke aku drive? So is he safe to drive now?
Yeah.
Yep.
And then bila tanya, kau ingat tak kau stay kat mana? Lillah tak tahu.
That's scary.
So that was the only part. So it's like, how do you manage it? Of course it's concussion lah.
Yep.
Yeah.
And for someone, so out of all the symptoms, you have all the 26 on the sports
Yes.
concussion assessment tool. Only had that one retrograde amnesia, not amnesia, memory loss for like whatever. It's just that specific thing that he could not remember.
Mm.
I met him, I think last year. Do you remember you came up to me and said that, I still cannot recall how I came with. So I had to trust them. So if I try to jog my memory, so I don't know.
Yeah.
I had another case. This was a friend's daughter. I think, they were staying in Middle East. The daughter got a head knock. No loss of consciousness, got dizziness. But from being a top A student, she went down a few classes. She's in high school lah, okay? And the reason was that every time she's in the class, she will start having headaches.
Yeah.
Persistent, and it took her a good 2 years, I think, to start playing again. So we're talking about returning to play, but actually there's another level to it. Returning to normal function, returning to classroom or work.
School.
Then only you go up to return to play.
Yeah.
So
that's-
especially for teachers, that's important. For parents as well, you need to recognize about that part.
So I think we've been pushing this, Azlan. Some of the courses we've been, especially like Tumabro College and all, saying that actually if you want to be strict in terms of return to sports and all, it's return to work and return to classroom first. So if you can do this unaided, you don't
normal
need
stuff.
aid in work and classroom, then only you can progress to return to sports, not return to play, but return to sports. So this is where we have these big limitations,
Yeah.
which we have to address, and all other countries, sadly to say, first world countries are much more advanced and looking at this as a welfare, not just regarding sports, but individual welfare lah.
And also when we talk about just now, Kiran and Hazwan said 12 days minimum. Okay, that's for elite level. But newer guidelines are saying 21 days for community level. So if you're not paid to play the
No,
sports
no.
in that
Some
way.
people get paid at community level. So as long as you're community level,
As long as you're community level, not elite level lah. Okay, alright.
no, elite still, but it's not your occupation.
Not your occupation. Okay, great. So that's a better way to
Or
explain
lagi
it.
satu, you have access to serial MRI, serial CT scan. So that's the only reason I would say you have accelerated pathway.
Yep.
So if you don't have access to that, you don't have a regular daily physio, please don't talk about it. Minimum, maximum, don't know.
Yeah.
So okay, let's point out what happened today. I was looking at the NBA highlights. I couldn't watch the full game. Spurs fan, Victor Wembanyama went down. His head hit the court.
The chin, right?
The chin. Face plant. Pop. Okay. That happened. And then he looked like he was unconscious for a bit. He tried to get up, but he was on his knees. And then he went back down, clutching his head.
Yeah.
So the bigger question is that, is the series gone? Possible?
They're playing who? Wolves, right?
They're playing Wolves.
Yeah.
Yeah. So that...
Well, that's part and parcel. That's part and parcel of sports. Can you prevent injuries? No, you minimize the risk of injuries. That's it.
Yeah.
And once it happens, you manage it properly.
Yeah, that's a good way for a conclusion for this. Gonna move on to our next part, our injury time.
Okay.
Yeah. All right, it's injury time. All right, quick fire. Yes or no? Okay. Concussion must have loss of consciousness.
No.
Is headgear going to prevent or reduce concussion?
Zero. None at all.
What about mouth guard?
Even more. Zero. None. It's a no. Big no.
Do you need to scan or not? CT brain MRI.
If there's red flags.
Okay. Do you need to refer or not?
If there's a bedside doctor, it's okay. But if you're not a doctor, yes, you must refer to be seen by a doctor.
Okay. So, Kiran, let's go. Injury time.
Okay, let's go.
Concussion? Must it have
Are you concussed? Are you concussed?
Are you concussed? Hey,
you ask him.
Okay, Kiran, do you need loss of consciousness in concussion?
No.
Does headgear prevent concussion?
No.
Mouth guards?
No.
Nope also. And then what was the next one?
Scan.
Oh, okay. Do you want to send someone for a scan when they have been suspected of concussion?
Yes.
For all?
If I think there is concussion, that means I think there's red flags, I would scan.
So
That's
with or without red flags that you'll do for the
With
scan?
red flags.
Okay, alright. Without red flag, no scan.
Up to the doctor in charge.
Okay, alright. So what was the last one again?
Refer.
Refer.
Okay. Do you need a referral after concussion?
I think same as Hazwan. Meaning, if you're a doctor, then you can. If you're not a doctor, please refer.
Okay, Azlan, I'm not going to repeat the question, so just stay in order lah.
Dia dah concuss.
Okay, so do you need
This is
LOC?
memory recall. Memory recall.
So part of the squad lah. So do you need LOC for concussion?
No.
Would you say headgear prevents concussion?
It does not prevent concussion.
Would you wear a mouth guard to prevent concussion?
I will ask them to wear mouth guard regardless, but it will not prevent concussion.
Okay, so would you send every person that you suspect to have concussion for a scan?
No. Unless there are red flags. Okay.
Okay. So what was the last one?
Refer.
Oh, would you
I'm the only
advise
one- I'm the only
referral
one not
for
concussed here.
concussion?
Can you repeat the question again?
Do you need a referral to a doctor if you have concussion?
Yes, you need reassessment.
And just so you all don't
Is that
get,
possible?
just so you all to understand, I'm the only one not concussed here. And these two are clearly
No,
concussed.
I'm just hungry. Told you the symptoms of concussion mimics hunger.
Tadi kau
Okay.
salahkan perangai kau dekat
Itulah.
head
That's
injury.
why
Lepas
should I
sekarang kau
blame myself?
salahkan
Why
kat
should
kau
I
lapar.
blame myself when I can blame something else?
Concussed.
That's how life works.
Concussed.
You want to be ahead in life?
Concussed, bro.
Fall others.
Lovely.
Okay.
Guys, thank you for tuning in. For coming back and watching our episodes again. Hopefully there'll be more and more in person. Hopefully Kiran pindah balik KL ke or come down regularly
Hold
lah.
on, let's just make one announcement. Anyone who's willing to sponsor us, especially for his tickets to come back from KK to
Oh, wow.
back to
I did
KL.
not see this coming.
You can
sign
please
up for their
contact,
course,
contact
then they
him
can-
directly, maybe for free consultation or something. So the ROI and all depends on him lah. Let's see if you're marketable lah.
Okay.
How much, Kiran? How much?
It's okay, guys. Sign up for their courses, then they can sponsor me. Yeah.
Yeah.
It's somewhere here,
He
written.
holds a course, but he never invite me to Sabah.
Oh God. Here we go. Okay, I think we're done.
Okay. Alright.
Alright,
Thank you.
guys.
Thank you guys.
Thank you, guys.
Thank you.